Good morning. Today we'll be talking about kidney health, maintaining kidney health in line with the World Kidney Day theme of kidney health for all. Good morning, Dr. Bamgboye. It's always a pleasure to have you with us.
Good morning, Pamela. It's always a pleasure to be with you.
Yes, so today we want to talk about kidney health, and you are an expert in kidney disease. Can you tell us why the World Kidney Health Day has the theme of kidney health for all, and some additions to it?
Well, this has become a yearly, event now, and the International Society of Nephrology and the International Federation of Kidney Foundations have, for almost the last 20 years now, recognized the second Thursday in March of every year as the World Kidney Day. And over the years, we've gone ahead and focused on several, themes over the years. So the theme for this year is kidney health for all, preparing for the unexpected, and taking care of the vulnerable as it is. I suspect that what must have informed their decision to focus on that this year must have been two events that we're all quite familiar with. The fact that during the course of the pandemic, we found that patients with chronic kidney disease particularly suffered much more than the average person. They were much more vulnerable. When they developed the illness, they were a lot more sick than other people. And the risk of mortality was much, much higher amongst such patients. And then, of course, the recent earthquake in Turkey, where so many people have died so far. And it's found that it has disrupted services for individuals who are being managed for chronic kidney disease. So I'm certain that that must have influenced the committee's decision to focus on that this year and say, we recognize that patients with chronic kidney disease are vulnerable in many respects. And when disasters do occur, very often you find that they are worst hit. Dialysis services are disrupted. Because of the nature of dialysis, to very close contacts and having to come into hospital. So all these things make them a little more vulnerable. And the idea is that, look, we should, in everything that we do, bear in mind that, when we are preparing for such disasters, actually plan to have services for such vulnerable people kept in mind and provided for. And so that's why the focus this year is on that. And one is hoping that when such disasters do happen, we would have planned and had such vulnerable people in mind, and whatever plans we have made.
That's fantastic. So can we coming back home, as it were, can we talk about kidney disease? Just in case anybody who's listening doesn't know about kidney disease, just run through what causes kidney disease, what the issues are, and how people get to kidney disease before we then turn to focus on what are the kind of measures that we have in place for treating kidney disease, and if those kind of additional measures for protecting the vulnerable are things that would be easy for us to put in place here.
Well, kidney diseases are, despite how insignificant in size the kidneys are very ubiquitous in the life of the medical life, in the sense that as small as the kidneys are, their functions are such that if for any reason they don't function optimally, it affects almost every single part of the body. So the kidneys are no bigger than the size of your fist. But despite that size, they take on about a quarter of the size of the volume of blood that comes from the heart. And that in itself is a reflection of the function that they have. So you find that once the kidneys then fail, not only do you now develop hypertension, you become anemic, but you start to accumulate the wastes of metabolism. And on account of that, you are now not able to function optimally. So once that happens, more so if it is the chronic type, which by definition is irreversible and progressive, staying in life. And once that happens, you have to support the kidney. You have to do what you call renal supportive care. And that usually comes in two forms. You're either having to do dialysis, and dialysis can be in the form of either blood dialysis or what we call hemodialysis or peritoneal dialysis. But in the absence of those, you find that you could sometimes try what you call conservative measures, but that only more or less is like palliative care. The ultimate is for you to have a transplant. Now, all those forms of treatment are available here locally in Nigeria. So you can have peritoneal dialysis, you can have hemodialysis, and certainly you can also have transplantation available in Nigeria. Okay, as to the things that cause kidney failure, particularly the chronic kidney failure in our own environment, hypertension is notably one of the commonest causes in our environment. As we know, hypertension is particularly common amongst people of African descent. And it's believed that over the age of 50, 60, almost 50, 60% of individuals would have hypertension. And the problem of hypertension leading on to kidney failure usually emanates from you're not recognizing that you have hypertension. And we know that only a third of people with hypertension actually recognize that they have it. And even if when you know it, only a third of people who know that they have hypertension are on regular treatment. And only a third of people on regular treatment are well controlled. So the bottom line is that majority of people either do not recognize or are not on treatment. On account of that, majority of people are not well controlled. So it's not surprising that quite a few people develop kidney failure from hypertension. Secondly, diabetes. Diabetes is also becoming much more common in our environment. It used to be only about 2.2% of the adult population. Now we're approaching 10% in the general population, but certainly much more amongst some groups of people, particularly in urban areas, amongst the privileged people in society who generally tend to obese and do not engage in enough of physical activity, eat the wrong things. So diabetes can be as high as 30, 40% in such groups of people. And unfortunately, only 50% of people who have diabetes know that they have it. And very few of them, even when they know they have it, are well controlled. So diabetes is another not infrequent cause of kidney failure in the environment. The third on the list would, of course, be chronic glomerulonephritis. And that, to simply explain it, is a chronic inflammation of the kidney that usually follows chronic infections that you do not either recognize or don't treat appropriately. So it could follow any chronic infection, even malaria, if you don't treat it, don't recognize it and treat it properly. Hepatitis B, hepatitis C, HIV, any chronic infection that stays a long time in your body. The body, in reacting to it, somehow results in chronic inflammation of your kidney, which leads on to damage of the kidney. If anything in our environment, this probably might be the commonest cause of chronic kidney disease that we find in our environment. And that's why you find that patients in this environment generally tend to be slightly younger than patients in the developed world. In the developed world, the commonest cause is diabetes. But what we are seeing gradually is that diabetes is increasing as a cause, even in this environment. But aside from these three major causes, there are a few other causes that I always use opportunities of this type of interaction to also, lay some emphasis on the use of bleaching creams. Many of these contain heavy metals, particularly mercury. They were banned some years ago, but they're back in circulation now, and everybody's bleaching. Not just the ladies, even the men now are bleaching. Then, of course, the use of the non-steroidals, these strong analgesics. We also know that more so in those who are vulnerable already, if you have hypertension and diabetes. And you now go ahead and start to use the strong analgesics, your diclofenac, your ibuprofen. Many of these drugs have long-lasting damage to the kidneys by causing some kind of what we call an interstitial nephritis. So one needs to be careful, and with the use of over-the-counter analgesics, and certainly if you can, also if you already have problems with your kidneys, completely avoid their use. Then, of course, the use of native herbs. So all your agumu, your herbal supplements of different sorts, your agbos, we know that many of them contain toxic substances that we know actually can serve as either initiating agents or aggravating agents. So it's either they themselves cause the kidney damage, or alternatively, if you already have some form of kidney damage, they make sure that you very quickly progress until the stage where you end up in end stage and the kidney function is not sufficient to sustain life. Then things like sickle cell disease, things like obstruction in men from prostate, in women from fibroids. So you find that all the common things that bedevil us at a certain age in this environment, I think, if not well managed, can result in problems with the kidneys.
Thank you. Mr. Bamgboye, that was very useful, wrap up and sort of summary of how kidney disease comes about, particularly in our own environment. But, about these challenges that the World Kidney Day has brought, how can we, do you think it's possible for us to overcome some of our own limitations and still be able to plan these emergency situations and plan for them and assist the patients who have kidney failure, particularly since a lot of people don't even know they have kidney failure in the first place?
Well, I think it's something that inevitably we would have to deal with. Like you've rightly identified, I think it's estimated that for every million of your population, you have 100 people requiring to join dialysis lists in every single year. So for our population of 210 million people, we expect that there should be 21,000 new individuals requiring dialysis every single year. Now, I'm privileged enough to know, the total number of individuals on dialysis in all the dialysis centers in Nigeria. And I can tell you that it's barely up to 5,000. And that means that if 21,000 people require dialysis and only 5,000 of them are getting it, and if you don't get dialysis, you succumb, you can imagine the number of people who are dying on account of kidney failure, either from not recognizing that they have it or from having the resources to be able to deal with it. So the issue is that, first of all, do we have enough dialysis units around the country? I can tell you no. I know as at the last count, there are about 210 dialysis units all around the country. Many of them are situated in the urban areas. Many of them are in public hospitals. There are quite a few in private hospitals. But the issue is that despite the number that you have, people are having to actually pay the costs out of pocket. And that's the problem. Because unlike happens in countries like Kenya, for instance, in Kenya, the National Health Insurance actually covers the cost of dialysis twice a week for anyone who has kidney failure in the entire country. Kenya doesn't have the resources that Nigeria has. They don't have as many nephrologists as we have. We are supposed to be an endowed country, so I do not see any reason why Kenya can do it, and I don't see any reason why we, as a nation, Nigeria, cannot do it. So the point I'm making is that we're not even providing for people in normal circumstance. So when the emergencies then do come, I can tell you that we do not have the setup to be able to adequately provide for them. God forbid that we should have an earthquake in Nigeria. I mean, if that happened, all services will be disrupted. And even the services in both public and private hospitals that are barely managing to cope find that they will definitely not be in a position to provide services optimally. Aside from everything else, all the consumables are still imported, all the machines are still imported. Almost all the drugs that we use in managing patients, both during dialysis and during transplant, are all imported. So it can be certain that if there's disruption of services such that nothing can come in, then our patients definitely would suffer. So as to what can be done, I think there's a lot that should be done. And I think you should, first of all, start from government recognizing that this is a significant problem for us as a nation. The association, the Nigerian Association of Nephrology, is trying to, through a renal registry, at least be able to give definitive figures as to the number of patients requiring this service every single year. And maybe that can then be used to sensitize governments to the size and the magnitude of the challenge that we're facing with individuals with kidney failure.
Well, I think, thank you. That's important. And I think at this time, particularly at this critical time, where there's a change of government, I think your voice, this is a timely time to speak up and for the new government to listen to some of these challenges that we're having and make sure that as the new NHIA is being implemented, some of these things that you're talking about get taken into consideration. Mr. Ajah, thank you very much for coming on the program. Can you tell us quickly, how come you set up this foundation for helping people with kidney disease?
Thank you for having me, Dr. Pamela. We set up Give Hope to Kidney Foundation sometime in November 2017 because we saw a serious need with the post-transplant, especially with the post-transplant kidney patients. We had a couple of them who usually came to us. When they purchased drugs for a month, excuse me, when they purchased the drugs for a month, we find out that in the next 6 weeks, they have not come back for a refill. So we realized that, we initially thought they used to go somewhere else, but we found out that it was because of costs that they were not coming back for a refill. Sometimes they stretched as much as two months for a medication that's ideally supposed to take them just 1 month. So I called one of them and I began making inquiries. And they said it was because of money. So I got some friends of mine. We started helping to pay for I remember the guy, he used to come from Elisha, particularly. I'll just call him D. Dotun. So he used to come. So anytime he comes, I'll ask him and he'll tell me that he cannot cope with this, that can I just give him half or give him for a week, and he's going all the way to Elisha. So I'm wondering, how would this last you when you come back? And one thing that touched me about this particular patient, his mother was his donor. His mother, who is in her 70s, because he was in his 30s, early 30s then. So he kept on coming. So I kept on arranging for my friends and I to pay for his medication. But I realized that as soon as we started doing this, some other patients too, I noticed this lapse with them. They were missing their medications. And I realized that we started even losing some of these patients because they couldn't cope with the bills, the cost of immunosuppressants.
These are people who have had their transplants. So
yes, who have undergone.
And so hopefully should actually be able to run, but the cost of the drugs was just too expensive. Please carry on.
Yes, too much. Yes, too much for them. All right. So, and some of them did not quite understand that they needed those drugs for life. They thought maybe just for a couple of months. You know how you use antibiotics. Some of them just thought maybe use for 2-3 months and that will be all. So I found out that I began to educate them that those immunosuppressants were for life. So it got them more confused because some of them were not really so well to do. And as Dr. Bamgboye so rightly mentioned, it's not covered. Kidney ailments are not generally covered by health insurance because of the high premium that will be required, I suppose, you know. So in fact, one was actually laid off work because of his kidney ailments. So we lost, I think 1 or 2 before it just dawned on me that we needed to get into this space, do something to help this. We call them survivors, like they have battled dialysis 3 times weekly, the chronic care that comes with kidney disease, all the erythropoietin and all that, then getting a donor, the rigors of getting a donor, the transplant itself, recovering, then thinking that you still have to take these drugs for the rest of your lives, and they're expensive. And as Dr. Bamgboye so rightly mentioned also, we import these drugs. They're not necessarily, they're not manufactured here. So we got together to initiate this foundation to help these patients in that space of kidney management, post-transplant kidney patients.
So just in case there's anybody who's listening, because unfortunately time is far spent, we have to go now, but anybody who's listening who wants to support your foundation, can you give a phone number or how can they reach you?
Okay, we have a website and we have a phone number on our website. The phone number to reach us will be 081-7848-7499.
Can you repeat it?
I will. 081-7848-7499.
And the name of your foundation?
Give Hope to Kidney Foundation. We're on Facebook and we're on Instagram, same name.
Thank you.
Give Hope to Kidney Foundation.
So Dr. Bamgboye, just in case, I know that there's no time left actually, and we've run out of time, but do you have any last words for our listeners, or particularly for our government and the new government that's coming on board, and what kinds of things they can do to help us in this regard?
Well, the big thing is that one must recognize that kidney failure is a very common problem. It's probably best to detect early and, if it's possible, to prevent. So even the better endowed governments in the developed world are having problems coping. In America, they're spending about $40 billion every year just managing individuals with kidney failure. So they themselves recognize the need to focus on early detection and prevention. So one would encourage governments to delve into prevention programs. And it's simple. If you have hypertension, detect it early, provide medications. I was shocked when I had to go and buy, antihypertensives for a patient of mine. And I found even just one single one of them costs almost 10,000 naira. If you then realize that minimum wage is 30,000, so you can imagine somebody who's earning 30,000, how is he going to spend 10,000 naira on just buying one drug? And the reality is that most hypertensive would need about 2 to 3 drugs to control that blood pressure. So you can imagine the costs. So what I would advise is government should focus on the common things that we know, those common ailments that we know lead on to kidney failure, hypertension, diabetes. Detect them early, ensure that you provide medications and support services to prevent a situation where these illnesses eventually result in kidney failure.
Thank you very much.
Let's start focusing on trying to provide services at a cost that is affordable to individuals. So NHIA should be able to provide support for individuals who have kidney failure. And it should go beyond the 6 sessions of dialysis that they now support. There's no reason why Kenya can do it and Nigeria should not be able to do it.
Yes, I strongly agree with you there. And I also think that we need to focus on local manufacturing of our drugs. I think that would go a long way to reducing the cost, supporting our local manufacturing. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.